Imagine a world where every second matters, where the difference between life and death hangs in the balance. That's not a scene from a blockbuster movie, but a reality when someone's heart stops beating. Knowing how to perform cardiopulmonary resuscitation or CPR can be the deciding factor in this critical moment. CPR techniques for adults and children differ slightly, each with its own set of steps to follow. So let's delve into these life-saving procedures. When an adult falls unconscious, safety comes first. Ensure the surroundings are secure before approaching to check responsiveness. If there isn't any, immediately call for emergency services or instruct someone nearby to do so. Assess the victim's breathing and pulse. If the person is unresponsive and not breathing normally, it's time to initiate CPR. Position the heel of one hand on the center of the adult's chest, placing the other hand on top with interlocked fingers. Apply force to perform chest compressions at a rate of 100 to 120 per minute, making sure to allow for complete chest recoil between compressions. After 30 compressions, it's time to open the airway. Tilt the head back, lift the chin, and deliver 2 rescue breaths. Continue this cycle of 30 compressions and 2 breaths until help arrives or the adult shows signs of life. Switching gears to pediatric CPR, the initial steps are quite similar. Ensure the scene is safe, assess the child's responsiveness, and call for help if they're unresponsive. Here's where the differences start to show. For infants under 1 year, use 2 fingers to compress the chest, about 1.5 inches deep. For children from 1 year to puberty, use the heel of 1 or 2 hands for compressions, aiming for about 2 inches deep. Just like with adults, follow the 30 compressions with 2 gentle rescue breaths. But remember, when giving breaths to a child or an infant, cover their mouth and nose with your mouth. Continue these cycles until help arrives or the child shows signs of life. To sum it up, both adult and pediatric CPR involve checking for safety and responsiveness, calling for help, and performing cycles of compressions and breaths. The key differences lie in the technique and depth of compressions, and how you deliver rescue breaths. Remember, CPR is a critical skill that can save a life, but it should only be performed by those trained in its proper administration. Continue CPR until professional medical help arrives. Knowledge is power, and in this case, the power to save a life. So, equip yourself with the right information, get trained, and be prepared. You never know when you might need to step in and make a difference.